So I chose the UAMS College of Public Health because I knew that the class size would be small. So I figured compared to my undergrad experience, that would be preferable to be able to have relationships with my professors and my classmates, something I value. And I chose epidemiology as a concentration because I love science. So, as an undergrad, I took a class on social stratification, and I was really excited about how social class can impact health. And the more I dug into it, and I took an epidemiology class as an undergrad, and I just loved it.
I'm originally from Washington, D.C., so I came from a university of 2,500 students. So I had a very close relationship with my professors and very much so the community around me. In terms of just doing different public health acts and works, that's what I was very common with there. So I was looking for that same relationship here. When I came to UAMS, I felt that exact same community. So that's why I chose the College of Public Health, mainly because of my background. In epidemiology, I think that's largely because I want to be an advocate for my community. In epidemiology, a lot of times there are a lot of diseases that and disease patterns and occurrences that affect a lot of people differently. And a lot of people don't know that they have a higher risk than others. And I want to be an advocate for those who don't know.
I was working in research, and I was taking a certificate program at the Masters of Public Health. Yeah, the MPH, the certificate program, though. And I found that the classes were really helpful for the work I was doing. And I particularly enjoyed the focus on the importance of, from the beginning, doing the study designs and figuring out what is going to produce the most valid results for your study. And then I chose the UAMS College of Public Health because it is a small school and the faculty were very available, even to me in a certificate role. And so I knew that when I joined the PhD program, it would be so much direct mentoring and experience that way.
So after I graduate with my MPH, my Master's of Public Health, I plan to jump right into the workforce. I'd like to get involved in community-engaged research. Right now, I really enjoy it's a tough topic to talk about, but maternal mortality is a big issue right now, and it has been. So I'd like to ultimately influence public health policy aimed at intervening on maternal mortality and decreasing that.
There are many things that I would like to do with my epidemiology degree. I think that first would be research, and then the second would be education, as I stated before, just to educate those people who don't know about the things that they ought to know about in terms of public health measures.
Okay, well, I hope to continue in research. I've not decided 100% if I'll go academia or if I will go more state or federal level, but either way, I want to focus on study design, human subject research, and that kind of stuff. The support of all the faculty and the advisors and having the chance to actually contribute to research studies that are going on and hear from my peers and just build that experience.
The most beneficial part of being a part of the epidemiology department is hands down my advisor and my mentor, Dr. Joseph Su. He's taken me under his wing. He's taught me so much. He's given me every opportunity for me to explore this field and get involved in his research projects. And even if my experience was small at the beginning, he's helped me tremendously.
The most enjoyable thing I would say would have to be the relationship with faculty and also with my colleagues. School is hard, but having a good group of people that you can laugh with and also ask for advice about things with is very helpful. My advisor, Dr. Muhammad Orloff, I've been out here for 3 years, so he pulled me up under his wing and said, hey, apply for this, or, this would be a great conference for you to get involved in. And without that community of friends and the guidance from faculty and staff, I don't know if I'll be able to do it. But the idea that it's bigger than me And I think that has been like solidified throughout this process, mainly because, you know, you go through school and you're like, hey, well, I'm going to get this grade, I'm going to get this A. But you never really understand how the information that you're retaining at that moment can therefore not only just impact you, but your larger community. So I think that would be my takeaway from the department and from UAMS.
So I attended the MPH program a few years back, so I had a gap between my current studies and when I did the Master's of Public Health. I chose to do the Master's of Public Health after meeting with faculty before I enrolled to figure out if this was the best program for me. And so what I had done was evaluated what my favorite areas of study were. And so those were statistics, biology, immunology, and then some population genetics, because I had previously worked as a laboratorian. And so after meeting with faculty, it sounded like a lot of the areas that I was interested in could be encapsulated into the Master's of Public Health with an epidemiology focus. And so I was actually able to work full-time while getting my Master's of Public Health, and that really benefited me because I was working in epidemiology while also learning it, and so I was able to learn those practical skills that have benefited me at my job. There are a lot of jobs available for folks that pursue the MPH with a concentration in epidemiology. I can give you my personal experience, but I also know quite a few other fellow students that have had really productive jobs. I transitioned from a laboratorian role to an epidemiologist role at the Arkansas Department of Health, where I work on healthcare-associated infections and infectious disease area. However, there are epidemiology roles in almost every facet of health, including communications, chronic disease, infectious disease, as I've mentioned, trauma. There's also some interesting things looking at healthcare quality with like the opioid epidemic, so prescription drug monitoring, and actually in the program that I work in, we just added an antimicrobial resistance epidemiologist. So as new and current topics emerge, we need people that are able to evaluate those topics, identify our risk factors, and then target our public health programs. I have not finished my PhD yet, so I am hopeful that there will be plenty of jobs. However, I have been able to work with PhD or persons that have the PhD to see what kind of jobs that they have. And so to be able to differ that between someone that has a master's level versus doctoral level training. And what I really think it comes down to is some of the oversight of how the data is collected or how the program is managed. And so in my doctoral studies, some of the things that I'm learning are to critically evaluate what are the needs and then to be able to design projects and programs to address that, whereas at the master's level, you're usually doing the frontline, in-the-depth work with the data. There are other things I'd like to say about the epidemiology program. One of the reasons that I chose the UAMS over other programs was its strong focus on methods. And that was the reason specifically for me because I had transitioned from another career. And so what I have been able to do is take the job efforts that I had done in laboratory science as well as in patient safety and then been able to apply that with epidemiology training to work at the health department in that area. And so since we focus on methods instead of content, it allows you to have a broad range of focus and allows you to adapt to new and emerging topics quickly, which is something I'm really interested in.